Ambulance service, patient breathing.
We're back on the front line, following Scotland's paramedics.
Suspecting an opiate overdose.
For a gentleman said he's got a bomb. There's a RTC bus versus car.
What do you mean by his arm's gone? I need to get these details, OK?
Every day, they save lives.
There's the boot off, all right?
Just had a fit for quite a few minutes.
Hello?
Oh my God.
We need to be away from that.
And every day, they face new challenges.
When we go into people's homes, they are at their most vulnerable.
I just don't want to be here.
These things are hard to hear, and we hear them on a daily basis.
Just keep pushing, you're doing really well. We are given the instructions to help save their life. 1, 2, 3, 4.
Working remotely comes with challenges. So if it's a day with a day.
Met some great patients, get some great stories.
That's okay.
It's a great job.
Slow, deep breaths, OK?
It's opened my eyes to life.
This is Scotland's ambulance service, serving more than 5 million people in every corner of the country. This time, we're with crews in Aberdeen, Glasgow, and Edinburgh.
Shall we? Yes, we shall.
999 mode activated.
SORT paramedics Alistair and Jason are heading to one of the capital's biggest landmarks.
We're going to Arthur's Seat, centre Edinburgh, for a patient that's fallen at the top of the hill.
Arthur's Seat is a large volcanic rock. It's quite a tourist hotspot because it offers good vantage points.
It's really quite a challenging hill for footwear and stuff. You really should be wearing some proper shoes or boots and things, but people go up there with trainers and flip-flops and stuff. It's really quite slippy, so quite common for people to have falls up there. Typical rain comes on now.
I think she's going to be rather wet, cold. When we're accessing outdoor areas where a person's injured, we always have to bear in mind the weather. Especially when it comes to trauma, it can really quicken a patient's deterioration if they're exposed to the cold. Oh, look out for tourists looking the wrong way into the road.
I know, yeah.
It's gridlocked. Everybody panic.
Yep.
At Arthur's Seat, Alistair and Jason will have to ascend more than 700 feet to reach the patient.
SORT team leader for crew on scene. One of our vehicles is just arriving.
She wasn't able to stop any.
No.
An ambulance has arrived moments ahead of the SORT team.
SORT 275 on scene.
All right, how's it going?
So I think she's fell descending the hill.
Yeah.
We'll get loaded up then.
Sure.
The journey is too rugged for their standard SORT vehicle, so Jason, along with one of the ambulance crew, will ride with the park ranger in their 4x4.
Okay, you're going to head up just now and...
Yeah, absolutely.
Brilliant.
Meanwhile, the SORT team's own all-terrain vehicle has been transported to the site.
We'll get that unloaded anyway, ready to come up. Okay, cheers.
Park Ranger Gordon has to drive along footpaths to get near the top.
That's busy. Hi, I'm going through that way. Can you move out that way, please? Come out the way. Thank you. So I've got to go quite careful, but it will be a little bit bumpy again. Just try my best not to clump anything. There we go.
By now, the patient, Jennifer, has been exposed to the elements for over an hour.
Yeah, just there. There's somebody. See them just up here.
What's going on in Aberdeen this evening?
I know.
We've been allocated this job to a 73-year-old male, and it's been coded as breathing problems. However, our control have updated us and advised that there is a second male outside the premises. The male outside apparently has blood on his arms, so we don't know if something's gone on inside. We have asked the police to attend to support us.
For the past 5 weeks, paramedic Wendy and ambulance technician Dawn have been joined by Amy, a student in the final year of her paramedic course.
Just need to approach it really carefully.
Scene safety. Danger.
Tonight is Amy's last ever training shift.
I really like to work with Wendy and Dawn. They have really helped me to learn. Going into working as a paramedic, it's been one of the best placements I've ever had. I'm too small to be able for these to do anything. The sun just comes underneath.
With 2 patients and reports of bleeding, the paramedics face an unpredictable scene.
I'm going to turn them off, actually, because I really want to be drawn attention to this situation.
Amy, just make sure you approach with caution, okay?
Yeah, absolutely.
With the police still on their way, the paramedics are the first to arrive on scene.
Hello there.
You've got one line here and you've got one line below.
Right, okie dokie.
Hello. I'm Wendy. What's your name?
Never mind.
Okay, well, listen. We're here to help, all right? Okay. I'll leave you to it. The police will be on their way. I don't need to be told twice impolitely to go away, so I did. And we focused on the gentleman in the back garden.
Did you have a fall?
Yeah.
Yeah?
Well, maybe.
Maybe.
He was lying on a concrete path at the bottom of 2 or 3 steps into his house.
Have you had a lot to drink today?
I have a lot to drink every day.
Okay.
He's under the influence of alcohol. He's not able to tell us how long he's been outside, what happened, why he's on the ground. Just do a quick check hips.
Is this sore, me pressing?
No, it's okay.
Can you bend this leg? Right, can you pop it on the ground? That's it. Any pain when you do that at all?
No.
Okay. Yes. We're going to get you up off the ground then, because this is not a comfy place to be.
Just bend in the middle.
Where, you got pain there, where?
No.
Where I'm pressing. Tell me if you feel pain there.
Oh my God.
So we're going to lie you flat again, all right?
Back down, nice and still for me.
But as the paramedics lower the patient, Wendy spots a potential weapon.
Why is there a knife in your plant pot?
What?
Why is there a knife in your plant pot?
I've got no idea.
Okay.
Okay. Police are still coming, aren't they? Yeah. Perfect.
With the patient complaining of back pain, the paramedics will move him with a scoop.
I'm going to have a little feel in your pockets, okay? I just want to make sure there's nothing there that's going to hurt one of us. Okay?
Darling.
Right.
Touch my
Right,
Absolutely
that's enough.
not.
That's inappropriate, and that's not what we're here for. It's neither funny either.
No, but...
There's no but. It's not funny, and it's not appropriate.
At first, I didn't really say anything because sometimes people will use words that they kind of find that they think will be nice to call you, like darling and names like that, but it would get to a point where it just becomes too much. We're there to do our job, and we should be spoken to in a respectful way.
Well,
Right.
are you going to be nice to me?
We're all going to be nice to you if you listen to what we say to you.
You keep your head nice and still. Look up to the sky. Don't look at me, look at the sky.
Before they move the patient, the paramedics immobilize him to prevent any further injury.
The other gentleman looks like he's got...
1963.
So we've not been able to assess him fully yet, but once we get into the ambulance, we'll be able to have a look at him.
You're a babe, weren't you?
Well, I've been called worse, to be fair, and I'll take that. Right, we're going in. You'll feel a wee bit of a click just as we lock our trolley in, okay?
Okay, my darling.
With the patient in the ambulance, the team runs some checks.
Come and relax this arm for me so I can get your blood pressure.
I like how you go. Nice and warm.
Okay, so how much do you take on a daily basis? How much drink?
Oh, two bottles of wine.
Two bottles of wine.
Wine.
You're pretty.
Okay.
I
Is
like
that
that.
all you've had today? 2 bottles of wine?
Yeah, I would say, no, only one bottle.
I'm going to have a listen to your chest. Is that okay?
Yeah, sure. Holy.
Go and not speak just for a couple of minutes, just while Amy's listening into your chest.
You guys are give me a serious checkup, won't you? I like this girl.
Yeah, but remember what I said about being appropriate, though?
You do sometimes get the odd patient that will keep going, and you have to be blunt with them. You just have to say, look, I'm here to do a job. I'm not here to be spoken to in that manner. Usually that's enough.
While Wendy and Amy continue their checks, Dawn tries to speak to the second patient.
No, he's still refusing, so... What's happened? How have you both managed to fall?
Nothing's happened. He's a diamond.
I think they've spent the day drinking. Whether there's been then an argument and one of them has stormed off back to his house, we do not know. Amy, just run me through what you've done.
His breathing's fine, his equal chest rise and fall, he's clear on both sides. The rest of his body, there's no obvious long bone injuries. There's sensation to both legs.
Throughout the incident with that patient, Amy's ability to manage him was brilliant.
Okay, we're going to put some belts on you.
Jesus
And we're...
Christ. This is like space odyssey.
She was very mature, very assertive, and was able to understand that we don't have to tolerate that kind of behaviour. Right, we're good.
Martin, I'm not rude.
Listen to me. I need you to be as still as possible for a minute, okay?
Okay.
No talking and no moving. I feel like I've been quite mature from a young age. You want to show that you're confident and you're self-assured as a paramedic. You don't want to be overconfident. It's really about balance. You just want to take one step at a time and just try your best.
You're good to go, Dawn.
Right.
SORT member Jason is about to reach Jennifer, a woman who has suffered a fall near the top of Arthur's seat.
She did have people around her, which is always a bonus. You know she's getting some level of care. When we first approached, she did appear to be in a bit of pain. Hi Jennifer, I'm Jason. What's happened today?
I slipped on a rock and then I fell right onto my knee.
Okay. And how did you fall? Did you fall forward or?
I fell forward, yeah, kind of straight, right, all my weight right onto there.
Okay, great. So, as you can see, you're in quite an inaccessible part of the hill.
Yeah.
So we've got an all-terrain vehicle that we're going to bring up, but the trouble's getting you off this particular part. So we can either get a basket and get many hands on and sort of slide you down, or if we're able, which I think might be a lot safer, is if we can assist you to see if you can weight bear.
Jennifer has already received some treatment from a first aider who was passing by.
The first aider that was there had put quite a good bandage on and it was holding up well. There was no blood coming through. The patient was able to move her leg quite freely. Because we've done such a good job of wrapping up that injury, I think we'll leave it as it is and we can maybe reassess once we're in the ambulance. Where are you from in the world?
From Canada.
Canada. Are you on holiday or do you live here?
We're on our honeymoon.
Oh, right. Congratulations.
And we were supposed to do
Congratulations. All right.
Back in the car park, Jason's teammate Alistair helps unload their most versatile all-terrain vehicle, the Wolverine.
Despite Arthur's Seat being a relatively small hill for Scottish standards, it is quite treacherous. So getting the patient out of certain areas of the hill can be really quite difficult. So here's your taxi, just coming over the hill. Sometimes it's beyond our skill set and we need to call a helicopter in to airlift them off. But more often than not, we can just get a lot of hands round and carry them to a safer part of the hill where the Wolverine can take it from there. So you're in control. If it's sore or you want to stop, just say and we'll stop, okay? 1, 2, 3. In this instance, we decided that the patient was able to walk, she was able to weight bear, and that was going to be the safest option. You're doing grand, well done. Quite often when we go to people on the hill, they're on a holiday or they're trying to do something that should be a joyous experience. No trip to Edinburgh's complete without a ride in the Wolverine. Give us a good review on TripAdvisor. This particular couple, guess it's never what they planned for their trip. So this is just to protect your head because you do rock about a bit. Hopefully, if all checks out, then they'll be back on their feet, enjoying the rest of their honeymoon.
We'll be all right. We'll be all right. We'll make the most of it. I mean, it's hard to make the most out of it at this point, but it'll get easier.
It's an experience.
You know,
yeah.
That's a memorable.
It's a story from your honeymoon.
That's right. That's exactly what she said. So yeah.
Paramedics attend around 200 serious incidents on Arthur's Seat each year. Jennifer will be taken to the ambulance and then on to hospital. The ambulance service has control centres in 3 locations across Scotland.
Ambulance service, is the patient breathing?
Call handler Declan is halfway through a 12-hour shift.
Are they awake? Okay. Tell me exactly what's happened. It was the patient's brother who was having some concerns. The patient has a lot of complex medical conditions that makes him poorly. But it started to become clear that the patient was unresponsive. Not responding. That's okay. So we're going to check his breathing together to make sure that it is all right, okay? So when I say go, I want you to watch him closely and say the word now every time his chest rises. Yeah, start that now for me.
The patient is struggling to breathe effectively.
When you get a call like that, it's one that makes you sit up in your seat. When you know that there's a real medical emergency going on and that this is actually a life or death situation. Okay, listen carefully. I want you to lay him flat on his back and remove anything under his head. Right, so we're going to maintain his airway now, so I need you to place one of your hands on his forehead, your other hand under his neck and tilted back. So can you still see or hear any breathing? Right, so see if you place your hand on his chest, can you feel it move at all? Right, so you're getting slight movement. And can you describe the way breathing sounds? Yeah, pop the phone next to him for me.
On the other end of the line, Declan can hear the patient make a worrying sound.
As soon as I heard that gargling noise, I knew right away that we needed to start chest compressions. It usually indicates that somebody's either going into respiratory arrest or cardiac arrest. Okay, listen carefully. I'm going to tell you exactly what to do next, okay? You're going to place the heel of your hand on the breastbone in the centre of the chest, right between the nipples. Put your other hand on top of that hand. You're going to pump the chest hard and fast, at least twice per second, and 2 inches deep. So I need you to count out loud so I can count with you, starting now. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. The ambulance is getting closer. We've got multiple people coming to help, okay? Just keep going over and over. 1, 2, 3, 4. 1, 2, 3, 4. Guiding someone through CPR is a really surreal feeling for me sometimes. 1, 2, 3, 4. 1, 2, 3, 4. You just keep pushing, you're doing really well. 1, 2, 3, 4. 1, 2, 3, 4. This person could die, and we are given the instructions to help save their life. 1, 2, 3, 4. 1, 2, 3, 4. Just pulling into your street just now. They'll be any second, okay? Just keep going. Don't stop till that paramedic tells you to. 1, 2, 3, 4. 1, 2, 3, 4. Just tell me when the paramedic's in the room with you, okay? 1, 2, 3, 4. 1, 2, 3, 4. Right, I'll leave you with the paramedic, all right? You've done really well. Take care, bye-bye. That's the first CPR I've done in about 8 weeks. Yeah. That one was quite horrible because you could hear the compressions. They had the phone right next to him, so you could hear him pushing. When I first started in the service, I really struggled with coping with traumatic calls. And I went through a work counselling programme called Solace to help me come up with coping strategies and how to not take it home. And that's definitely helped massively. I'm quite good at leaving it at the door. Now I've got my routine that I get into my car, I put on my music, and I just sing my heart out on the way home, and then all my troubles are gone. I forget about everything that happened. Ambulance service, is the patient breathing?
The wedding will be either the 1st of April or the 8th of April. I try and work it on my days off. Because I don't have to take annual leave for it, unless it's like...
For the wedding?
Yeah, for my wedding. I don't have to take a whole run of shifts off just for a wedding.
Yeah, but it's your wedding.
I know, but I'd rather work it where it's like, I can maybe just take like 1 or 2 shifts off, you know? I'd rather take 4 off.
Yeah.
Aye.
Just for a wedding. Like, it is your wedding.
I know.
Kind of a big deal.
Crewmates Holly and Julie have been working together for the past 6 months.
We started our run together on the Christmas run. Like the 23rd of December is when we started.
Is it?
Yeah,
Okay.
because I was annoyed because I didn't get Christmas off, and I was like, I mean, I'm glad to be working with you, but I've not got Christmas off.
God, it's boiling.
I know, it's roasty toasty.
I've got a salmon pasta there as well.
It's gonna be
I know. Get food poisoning.
salmonella by the end of the night.
I think we've really settled into a kind of good working routine now, and yeah, we kind of just Julie just kind of knows what I need without me having to ask, and we kind of just know instinctively how the other one's feeling. So we are on our way to a 54-year-old male. It looks like he's a delivery driver, and he's fallen 2 feet, and both knees have popped. So he's probably going to be in a lot of pain, bless him.
I know.
The patient Doogie is in Slateford, in the southwest of Edinburgh.
What a shame. I know. That's like what happened to my friend. Did I tell you about that?
No.
My friend, bless her, she was dancing, and she somehow managed to pop both her knees at the same time. And she couldn't walk.
Oh, there he is, sir. Cool. Let's go.
Hello. Hiya.
Oh, hello.
So, what happened?
I'm waiting on a knee replacement.
Oh, okay.
And I stepped off and my knee just went. Big time.
Okay.
And then as I tried to support it with my other leg, I think my knees went the same.
Oh, no. Okay.
Doogie has fallen from the back of his delivery van and injured both of his knees. His colleague rang for the ambulance.
Can I just have a quick look?
Yeah,
Is that all right? And what did you feel when you came out?
Just a huge snap, yeah.
Okay, and like searing pain?
Yeah.
When a knee dislocates, it's essentially like the kneecap kind of pops out of place. It's an extremely painful injury. Okay, is it still in a lot of pain just now?
It's numb.
Okay.
Really numb.
Okay.
I've got pins and needles in both legs.
Okay, right. After an injury like that, if the patient's complaining about pins and needles or numbness, there is a risk that the blood vessels are compromised, and that definitely makes the injury more severe, and we need to get them into the hospital a lot quicker. We'll get you some pain relief, okay? Because we're not going to be able to move you until we've got your pain under control.
Yeah.
We can offer different kinds of pain relief, obviously, depending on the patient and their history. Usually gas and air, so Entonox. Right. So, I'll hold this for you just now. So basically, you just need to get a really good seal around that, okay? And big deep breaths in and out. That's it. Should make that funny noise, yeah. Perfect. We can also give some stronger medications such as morphine, which normally works pretty well. Perfect. Right, Dougie, I'll just start with 2.5. Oh, God, my knees are stiff as well.
Honestly, Dickie, you get no sympathy from us, by the way.
With Doogie's pain relief administered, Holly needs to examine his injury.
Yeah, it's dislocated, I think.
Yeah.
Can you straighten it anymore?
So if you pull that a little bit.
Yeah?
So it's definitely here. I think it's maybe needs to pop back in slightly.
There's nothing in my leg whatsoever.
Okay.
Given Doogie's symptoms, there's a danger that the injury has cut off the blood supply to his lower legs.
We really wanted to get him into the ambulance and be able to have a proper look at the injury.
You can manage to lift me up.
So we've got a thing, it's like a cushion that inflates. And it'll essentially take you to the height of the bed, so that then you just have to kind of roll onto the bed, if that makes sense.
I can roll.
Aye.
It's a great piece of kit for this type of thing where we're struggling to get someone up off the floor.
Right, so this
Because
is...
you got a fat guy around
I did not say that.
So, just to pre-warn you, this will inflate. So you're going to feel like you're tipping.
Right.
Just try and not move. And then I say putting that. Just grip onto the bed.
We start. Hold on to me if you need to. Okay, it's the first one. You okay? Okay, see, it does get a bit wobbly, so I'm just going to stand here, okay?
It's a break on up
Sorry,
top.
I think it breaks on up there. There we go.
Right, there we go. Now you kind of just need to shuffle.
Yeah, if you could support his leg, Jules, perfect. I'm just going to support your hips a wee bit, okay, and help pull you over.
Ah! Oh, the pain's on my thigh.
Okay.
Oh, Jesus.
Is that okay?
Just lean right back.
Okay. Right, there you go.
Well done,
That's it.
well done.
Just shuffle.
It wasn't the most sophisticated way of doing it, but there we are. You all right?
Fine.
Yeah, I'm all right.
Well done, well done. Let's get you in then, get you out the cold. Bit bumpy here, okay?
Sorry,
Right. That's okay.
Holly can now carry out a more comprehensive assessment of Doogie's injury and try to determine the cause of his numbness.
Sorry, we'll owe you a whole new wardrobe at this rate.
Sorry, it's irreplaceable.
It's good to go shopping, eh?
Aye.
Can you wiggle your toes? Really good wiggle, yeah?
Yeah.
And can you feel me doing that?
Yeah.
Okay. So I'm just checking for a pedal pulse, which is basically just to make sure we've got good blood flow going to the extremities. Because he was complaining of some pins and needles and kind of numbness, it would be a concern that maybe his knees popped out and is kind of sitting on like an artery or a tendon or something. It could cause a lot of damage, so we would need to get him in a lot faster to be seen if that was the case. But we look like we've got good blood flow and stuff just now, so that's all good. Because of the way he had been lying, it was more than likely that that was what was causing the numbness and pins and needles. So the fact that the feeling's coming back now, we're happy with that. That's good. Okay, I think we'll just get you up to the hospital. We'll get some straps on you. These just keep you safe from Julie's driving, you know, and all those potholes.
Dig should chat it, but I'm the best driver in the city.
Right, Doogie, we'll just start heading.
The team will take Doogie the short journey to Edinburgh Royal Infirmary, where X-rays will reveal the extent of his injuries. At Aberdeen's Royal Infirmary, Wendy, Dawn and student Amy are finishing up a job.
So today was my very last ever student shift. And Wendy has the very, very important job of deciding whether or not I am fully competent to finish my degree. I do trust her. I absolutely do trust her. She's been really, really backing me the whole entire time, so I don't have too much worries unless anything dramatic changes overnight. I think it's all looking pretty good so far. Hopefully.
The night's still young.
Ambulance service, is the patient breathing?
He's having difficulty breathing. My husband, Colin, was getting hives all over his body tonight, and he's now at the stage where it's progressed into his airway, and he's finding it difficult to breathe.
Just let me know when the crew's right with him or if anything changes, okay?
The patient, Colin, is showing signs of anaphylaxis, a life-threatening allergic reaction.
I'll take the bag.
Do you manage?
Yeah, yeah.
Oh, yeah. The ambulance has arrived.
Ambulance.
Is that the crew right there with you?
Yeah, they're just coming.
Okay, I'll leave you with the crew. Thank you. Take care.
Colin, we're going to work around you, all right?
When we arrived, the gentleman was obviously struggling to breathe. They had given him 2 shots of his EpiPen, which had little effect.
Have you had to use your EpiPen twice before? Okay. He's making almost a kind of stridor-type noise with his breathing, which could indicate that his airway is obstructed.
Colin, what is it you're allergic to?
They don't actually know. He's got this condition where it just happens.
Yeah.
Right, I know you're spitting and that. We're going to just hold this over your face, OK? Just hold it there if you need to, all right? That's a lad.
Amy prepares a shot of adrenaline to help reduce Colin's swelling.
Get away to get another wee injection, all right, into your thigh. I know. All right, buddy. Sharp scratch coming up, OK? That's it. That's the worst I'm doing to you.
Colin has suffered these severe reactions for the past 3 years. But despite previously being hospitalized in intensive care, the trigger for his attacks has never been identified.
But he's had 2 lots of his own adrenaline and ours.
Yep.
So we trip up to the hospital. Right, are you happy enough? I don't want to get you dressed. We take you downstairs like this. Okay. Don't rush, there's no rush, okay? You only have to panic if I start panicking. In those situations, anxiety can exacerbate your condition and the symptoms that you're facing.
All right, now there you go.
If you can reassure them and you are in a calm kind of manner, I think that helps. You might feel like you're panicking. You might be like the swan. It's all kind of calm on the outside, but underneath your legs are kind of going a bit fast.
Right. Okay, just use me. There we go.
You're doing so well.
There you go. I'll give you a hand with your feet, don't worry.
Right, I'm going to reattach you to my machine, all right? Important thing is, I want to see what your oxygen levels are up to, okay? Nice and calm for me.
So I know it doesn't feel like it, Colin, okay, but your body is getting enough oxygen, okay? So what Amy's going to do is she's going to see about popping a wee needle in your hand, okay, just so that we can give you any drugs through there, okay?
We are looking at a patient who has a potential to decline quite quickly, and it's about being prepared.
Right, this is going to feel a bit tight on your arm, okay? It's not going to be the most pleasant.
We want to be able to administer any medication to him quickly. And at least this way, we've got IV access, so we can go straight into a vein.
Now, there's going to have a wee sharp scratch, okay? You're doing really well.
You got it. I wouldn't be watching somebody do that for him.
You're doing so
I'm a bit
so
like
well.
you. I'm a bit morbid. I quite
No,
like.
we're not watching.
See, like when I go and get bloods done or anything, I'm watching.
We're a tired nurse.
Are you?
Oh, yeah. What do you think of my technique?
Oh, come on.
You sound a bit easier to talk now. Do you kind of feel it clearing a little bit?
A little bit.
Picked the wrong time to ask you that there, didn't I?
What we'll do is we'll give you a wee high flow oxygen, okay? Now, does that feel comfy enough? I know it's not very. There we go. So just slow, deep breaths, okay? Right, perfect.
Right.
Good to go.
It will be a 10-minute journey to the Royal Infirmary.
So basically what Dawn's doing just now is she's phoning the hospital ahead to let them know what's happening.
That gives them a little bit of heads up that we're coming in, and
make sure that the right treatments are there when we get there.
Okay, we're nearly there. You feel like you're getting itchy again? Yeah.
How's mouth looking? No edema. Do you feel like your tongue's getting bigger?
Go and stick it out. No, okay. This patient obviously is unable to sit out in the back of the ambulance for any length of time, given that his symptoms keep reoccurring. So he obviously needed further treatment quite rapidly.
Colin is taken to resus, which is reserved for the highest priority emergencies. For student paramedic Amy, he's one of the last patients she'll see during her placement.
Almost. It's just the test.
Okay, this is looking good.
Amy has taken a very proactive role. It's very good. So she's done me proud.
Yeah, I'm so glad you said that. That could have went really badly, but I'm glad it didn't. But I feel like we worked well together the whole entire time, so I'm very happy that it went this way. And you can totally sign me off tomorrow.
I will sign your book off, don't you worry.
He's shot, completely mobilised. Male hit by car in Broxburn. SORT 275, SORT 250 attending.
SORT teams are dispatched to complex incidents that require a more specialist response. Team members Ryan and Luke are on their way to what sounds like a chaotic scene.
It came through as an RTC initially, but then information changed.
People are on scene arguing. Someone told me to hold his neck, but it's not confirmed whether this is the patient.
Roger, that's all received. It was actually a male hit by a car. You need to change your thinking towards that big kind of trauma job. Could you send SORT 230 to this as well, just in case it is multi-patient over? As a SORT team, we do have a team at hand of 6 paramedics, sometimes 8, so why not use them?
What's the plan, Stan?
So plan B, deal with the guy that's been hit with the car if it's legitimate. We'll kind of just split up. When we were driving towards the scene, we seen a male lying on the road. Right. SORT 275 on scene.
The call suggested that a man had been hit by a car. But with one patient on the ground, there's no vehicle in sight.
Can somebody see what happened, please?
So he's not been hit by a car, no? Right, okay.
Tensions are running high as the police try to clear the scene of onlookers.
It was very evident that it's been a fight. How many folks been assaulted? Just one person.
I was passing by, I'm actually on my way home.
What's his injuries then?
Head.
There's a lot going on.
What's that?
A bit chaotic.
When you're early days in ambulance service, it does get very, very overwhelming. But as time and experience forms, you learn certain ways to deal with it. Simple things like stopping for a second, having a breath. I certainly try to identify who needs to be here and who doesn't need to be here.
Listen, what's your name? What's your name?
Excuse me, pal, can you get her away? You just get her away. She's not making the situation any better. These incidents do tend to attract a lot of people, and you can have people who are very, very drunk, very, very emotive.
But as the paramedics begin treatment, one of the possible attackers returns, armed with a slice of pizza.
Oh, yeah, mate, beat it, man.
What's it you're playing at?
Sorry, you're all right, mate.
Listen, he's getting
Police have
lifted,
got
pal.
it, nothing, so don't worry.
Just ignore him, pal, it's fine.
As the scene calms down, divisional paramedics start treating the patient. With multiple crew members on scene, Ryan and Luke help to coordinate the ambulance response. But then Ryan spots something on the ground.
That's not near that. What? It's not near that, is it?
I mean, it could be. He's not missing an ear. That's it. It's one of those moments where you just, what are you doing?
They bring the ambulance
Bringing the
down.
ambulance down, aye, we'll just get him in.
Cool.
If you let me get up, I'll be fine.
Concerned about the patient's head injury, the paramedics plan to take him to St. John's Hospital for further examination.
The police wanted to charge him and arrest him, take him to the cells. But for us, the priority was this patient's health. Colin, you pass that to the crew. What's your thoughts then with your man? Is he going to St. John's first to get his face into? I'd agree with that. So I think the police are saying they want to keep everybody here at the moment. But I think he needs seen, to be honest. I think medically first. It's just about having that professional chat with the other services on scene and tell them what our priorities are. He needs to go to the hospital. He has had alcohol, he's got a few facial injuries, so he will need assessed.
Yeah. So, well, that's the thing. If he's going up, we would just sit with him.
Aye. Aye, that's cool. Just over the years, we've always had a good relationship with the police anyway, so that does help. You need anything else for us? No.
Back for your pizza?
Aye. Might just take the one in the pavement, mate. All right. We can stand down there. Oh. Short 275 for control.
Eastern to sort 275, go ahead.
Hi, just for an update. So divisional crew have the patient safely on board their ambulance. They are going to be heading down to St. John's in a couple of minutes. The police are still within the back of the ambulance.
That's perfect. Thank you so much for all your assistance.
We'll just get out of here and then finish this once we're...
But sometimes you just find yourself in the midst of it, and the situation is evolving as you get there, and that's kind of what happened there.
Aye, but your wits about you with them, eh?
You be careful, aye.
Even just find that with night shift though, eh? Night shift's completely different from day shift. Like, you're a bit more vulnerable at night, and the calls change as well.
Aye. Presents different challenges.
Yeah, totally.
Right, back out again.
Paramedic Holly and ambulance technician Julie were both brought up in the nation's capital.
So Edinburgh is a really, really amazing city. It's busy, it's pretty big, it's very well populated. We're out and about and meeting new people in different situations all the time. You meet some characters, it's great.
So we're going to a green call for an 86-year-old female. They've woke up this morning unable to weight bear on their left leg, in pain, no injury. They're saying a query hip or pelvis fracture. Oh, I almost bought a house here. These look like nice flats. Then the first call. Yeah.
What's the name?
I know.
I know it.
You got a bug on your bib.
Be gone.
There you go.
Hi, Ina. My name's Holly. This is Julie.
So, what's happened today?
Nothing, that's the problem.
Ina has been in pain since she woke up. She rang her niece Christine for help, who then called for an ambulance.
I've got rather a painful hip. I can't wait there.
Okay. And you've not had any falls or anything recently?
No, but I've got osteoporosis.
Okay.
Osteoporosis is a condition that gradually weakens bones and makes them more likely to break.
Can you wiggle your toes?
Yes.
Can you feel me touching your toes?
Yes.
Okay.
Did it pop? Did you feel something?
No, I just couldn't take weight there on it.
Okay. Are you able to sit up in bed?
No, I can't sit up. I've got osteoporosis, so I can never sit up in bed.
Okay. So how would you normally get out of bed then?
Swing my legs over and get up.
Okay. Can we try that?
We can help you.
No, I can sit on the edge.
Yeah,
okay.
that's
Yeah, that'd be perfect.
Okay. So it can be really difficult to move someone under that much pain, and particularly as well with the osteoporosis because it causes kind of weak and brittle bones. Can I have a wee feel of your hips? Just this, sorry. So therefore, you're worried that you're going to cause further breakages or more damage to whatever might already be a broken bone. So yeah, we need to just be very careful.
Are you sliding off the bed?
A wee bit.
Do you want us to help you shuffle back?
You don't have to shout at me.
All right.
Sometimes if you arrive to a job, there's times that patients can be quite direct and quite blunt. When you attend that job, they've called you because they're in a lot of pain, and you kind of need to give them that sort of bit of wiggle room.
Grab onto me if you want.
What can I do to help?
That's it. We just don't want you sliding off the bed. I normally try to, be mindful that they're probably quite anxious, they're in pain. I'd probably be the same if it was me. So, yeah, just try and be mindful of that. What's the pain like at the moment out of 10? 10 being like the worst pain you've ever experienced?
Well, when I try to move or weight bear, it's 10.
10 out of 10, OK. So we'll get you some pain relief then.
Oh, yeah, I've had 2 paracetamol.
Oh, fab. When did you have them?
Just a while ago.
Are you allergic to morphine?
No.
No, OK. Would you like me to give you some morphine?
Yes.
Yeah. It'll help with the pain, and then we can get a chair and get you onto the chair. We've also got some gas and air we can try you with.
No, give me the morphine, please.
Holly and Julie will try to get her pain under control before they move Ina to the ambulance.
Can I take a spot of blood from your finger just to check your blood sugar levels?
Yeah, it's a gorgeous house, flat, beautiful.
Thank you.
Do you have any carers that come in? Or are you quite independent?
I'm quite independent.
Good. Right, sharp scratch, sorry. Sorry.
This is going to be tight, OK? I'm just putting a little tourniquet around your arm. Sorry, darling. So I can get a cannula in.
If you can't get one in there, you need to retire.
Yeah, you've got a cracker.
Did you work when you were younger?
Mm-hmm.
What did you do?
I was a physio.
So whereabouts did you work then? Did you work in the NHS or did you work in private?
No, NHS.
Right.
So what do you think you've done to yourself?
Well, I don't know. I'm not that. I'm not a doctor.
Neither are we.
But I know on X-ray that I've had before that the hip's got osteoporosis in it.
Mm-hmm.
So it was a sitting duck in a way.
Okay. So I wonder if it's just been, that your bones are kind of so weak at your hip that that's what's happened.
I think so.
Yeah. Definitely get a wee X-ray though.
There we go. Sorry. 1 second.
With Ina's pain relief administered, the crew can now help her off the bed.
All right.
Good.
If you just hold on to us, I promise we won't let you fall.
No.
That's it.
Good.
And
if you
another
grab my hand with the other hand.
I'm going to sit down.
Okay.
Well done.
Good.
Okay. Well done. Best going round that way.
Yeah, you're better going that way. I'll just meet you over here.
Cool. Normally you can kind of break down their walls a little bit, I think. You know, just ask about their life and try and take their mind off their pain or whatever it is that's going on.
Are you comfy in that position?
No, because my legs are uncomfortable.
What can we do to make it comfy? Like, do you want a blanket rolled underneath it?
Yes.
Cool, I'll do that for you. All you can do is try and build a rapport with the patient and really try your best to help the patient open up and maybe feel a bit more comfortable with you there, because they might be really anxious. So yeah, you just take it one step at a time and just try to be open-minded with it. They're not too tight?
No.
Fab.
Ina will be taken to Edinburgh's Royal Infirmary for a scan, accompanied by her niece.
How you've been very helpful, so thank you very much.
Oh, me? Oh, you're welcome. I'm just sorry this has happened to you.
So our final ticks. You ready?
Yeah.
There you go. Ah!